A very good morning to you again. Today we're going to cover the topic about follow-ups, the importance of follow-ups after hair transplant. It's not one fixed thing. Once done, you forget it. It's not like that. If you have had a procedure done, you have to be in consultation, in communication with the doctor for a long period of time. Many times, even beyond 5 to 10 years. But we're not talking about that. We are going to today talk about what are the 5 visits which are a must, either in person or online after hair transplant procedure, which you just cannot miss. You just cannot afford to miss. As long as we as human beings, living beings on earth, will exist here, there will always be an existential crisis. There is nothing permanent in our lives. Every body, every human cell deteriorates with time. So to expect a hair that has been transplanted, a hair that is part living and part dead, to exist for a long period of time, or even imagine it to outlast us, is a pipe dream. But are hair transplants not permanent? Yes, they are, but then you have to be in direct communication with the doctor in a long period of time, for a long period of time. You be in communication with me for the rest of your life, and I can assure you that the hair that I transplant will stay. Follow the instructions from time to time, and there is no need to get even a second hair transplant done. But people usually do not follow this advice. It is again human nature that when you get a result, when you achieve what you do, what you have got, it somehow reaches the back burner of your conscious self. You don't remember that there is a duty that you have to do besides what the duty the doctor has done. It's your bounden duty to follow up with the doctor and to take constructive steps from time to time so that your baldness, your thinning does not continue. Hair transplant does not control your baldness. It's a genetic thing, my friend. For controlling your baldness, there are other things. There are environmental factors, the lifestyle changes, and of course, medication. Unless you adhere to a set protocol that your doctor has chartered for you, there will gradually be a decline in your hair transplant results. And sometimes even your transplanted hair will fall off. And then you will think this is a failure. There's a failure of the procedure. It's not a failure of the procedure, it's a failure on your part, and at times on the part of the doctor who has not guided the patient properly. So let's go on to the talk today. So your hair transplant is done, and now your follow-up. Many times nowadays patients come from out of station. It's a global world today. People travel from all over the globe. People travel from a different city to another city, from a country to another country, from one continent to another continent. And many times I have patients who have traveled from the other end of the globe, from New York, from San Francisco, from Los Angeles, from Dallas, to get the hair transplant done. So it's a global village, and therefore follow-ups become more important. The good thing about COVID is that after COVID, people realized that online consultations have their value. And even now, online consultations and the software that we have become so modern and so sophisticated that there is not much difference. I'm just talking about the follow-up after hair transplant. I'm not talking about before assessment of the patient before a procedure. So follow-up of after hair transplant has become so convenient and so accurate that you do not have to come to a doctor for a visit. Many clinics would like to call you for a visit because they want to give you PRP. They've given you a discount, 50% discount, last minute discount, and now they want to make up for it by a scam called PRP. And they will ask you to come for PRPs every now and then. Well, that is a different thing altogether. But after hair transplant, you do not need to visit the doctor. All follow-ups are done online, and PRPs are just not required after hair transplant surgery. A PRP is not a DHT blocker. A PRP does not in any way influence your genetics. So use your common sense. How is PRP going to affect your hair loss when it is androgenic alopecia that you're suffering from? So the first visit after the hair transplant is the next day. The next day of the procedure, say after 8 hours, 10 hours or 12 hours, if you've gone back home or to your hotel room at say around 4 o'clock in the evening, the next day you come to the clinic at around 9 o'clock or 10 o'clock. You have to come only for about 45 minutes, 1 hour. In our clinic, our practice protocols require you to come for about 45 minutes to 1 hour. What we will do is, we will remove your bandages, clean the area, check for any displaced grafts, any grafts which have slightly popped out. We would like to put them in a sterile condition. We would also like to clean the donor area, and many a times all the bandages come off. Definitely the beard bandage, body hair transplant has been done. The beard bandage definitely is not required even on the day of the surgery. But the scalp donor bandage usually comes off the next day on your first visit. And that is the time when we will explain to you the care in the next 3 days, the care in the next 7 days, and till 2 weeks when the crusts come off, and what medications are to be taken with you on your flight or by road if you're traveling nearby, what medicines are to be taken, what medicines are to be consumed, how they are supposed to be taken, and a host of other things we will explain to you, do's and don'ts after a hair transplant procedure after your first visit. And then comes the second visit. The second visit, I mean, when I talk about visit, it does not mean a physical visit. It can be a virtual visit as well online, as we are discussing right now. So the second follow-up is at the 7th or the 14th day mark. Mostly it is at the 14th day mark when the crusts are coming off and the patient wants to show himself whether all is fine. So we will inspect the donor area, we will inspect the recipient area, we will inspect for any sort of infection, because the patient is right now not taking antibiotics because 5 days are well past. So if there are any pimples, any infection, because it's an open wound, sometimes some pimples may happen. So to preempt infection, we would like to start you again on antibiotics. So 2 weeks mark, 7 days also, 2 weeks mark is very crucial once the crusts are coming off. And at this stage also the patient is also quite unhappy with the fact that with the wash that he does morning and evening, a lot of hair have started to come off. Shedding has actually started to show its ugly head. So this is the time we have to reassure him that all is well. It is the roots we have planted, not the dead hair shafts. And the roots are doing the job. They are growing a new hair, and that is why the old hair is being pushed out by a force from underneath, which is growing a new hair. So psychological counseling is very important in this phase, ugly duckling phase, when a patient is very anxious. The patient, though he has well researched, but when the grafts fall off, which he has nurtured over the last 7 days or 10 days, and they start to fall off, he's heartbroken. So he wants to be reassured that these hair will come back, that he will not have a complete graft failure, which he will never have. He also knows, but he needs reassurance. After the second week mark, that is after the second follow-up, the next follow-up should be at 1 month. At 1 month, again, we follow up, we see about how much shedding has taken place. We ask the patient to recommit himself to the medication that we have told him to have, check how he is taking, what is the dosage, is he taking at the right time, is he also maintaining the care that we have told him. And at the 4 weeks mark, a lot of care is over. The only thing that is not to be done is no dyeing, no coloring of the hair, no playing. You can start contact sports after 6 weeks. So 2 more weeks of not playing contact sports like soccer, like other games, tennis, no playing all these games. And then if you're a Sikh gentleman, then you should not be tying a turban till 6 weeks are over. So we tell these basic points at the 1 month mark, and following that we have another discussion at 3 months mark. At the 3 months mark, again there is nothing left. The entire the bald area is just looking as it did before when the patient walked in about 4 months back for his hair transplant procedure. It's a shining pate that he has. There are very few planted hair which are visible now, and he needs again reassurance. We check on his medication. We see for any signs of infection. The donor area is completely healed. So has the beard area. If we have extracted grafts from the beard donor, so we basically inspect all around. What we cannot inspect is the roots inside. They are growing. They're doing the job. So the transplant has been done properly. I have seen the transplant. I've done the transplant myself, the harvesting and slip making, and supervised the plantation process. So all will be well, provided you are taking the medication and following the protocol of medication after the hair transplant surgery. So after the 3 months mark, the next follow-up can be at 5 months as well, but generally 6 months is better, because if it is 5 months, the doctor has to answer a lot of questions. So it's better to do it at 6 months, because that is the time when the first good salubrious result comes at 6 months mark. And at the 6 months mark, we usually go around, tell the patient to send us pictures with video, with a comb through video, see his donor area, sort out a certain of his complaints or queries that he may have. There might be some areas which are a little patchy still, but reassure him that in the next 9 months, this will also be covered. And then the next follow-up is at 9 months mark, when the hair have grown out fully. All patients are generally happy with the procedure. There are one odd patients in whom their objective, which might have been irrational, might not have been irrational, they think that they should have got much more growth. Or there's little areas somewhere which look patchy. Well, in this 9 months time, baldness also progresses, whether you take finasteride or not. There might be a small area where your native thinning hairline has receded a bit further, say half a centimeter, say about 3 millimeters or 4 millimeters. We do not argue with these patients. They are our patients. They have chosen my clinic, Darlingbird's clinic, and they have faith in me. We will offer a small limited touch-up procedure at the 9th month mark if they so desire. And after that, at 1 year, the follow-up. After 1 year, the follow-up visits are all paid, because now you have reached the optimal level of your post-hair transplant situation. Your result is in full bloom. After this, your follow-ups will be to preserve the native thinning hair, and that these will be paid consultations done every 6 months or every year, which is important for you to follow up, because if you want a head full of hair for the rest of your life, you have to be in touch with me for the rest of your life. Patients generally are in touch with me for 10 years, 15 years, and after that, they slowly sign off, because after that, there are other things that are more important to them than the hair on their head. So that is the talk for the day. Follow-up visits are very important. Please do not ignore your follow-ups, because time is ticking, and if you've missed a particular step during the post-transplant care period, that is gone forever. There is no resetting the clock back. That time will not come. So please be cautious, be safe, and be careful about your transplanted grafts. Your grafts are limited. Let's give them the best chance to survive. So thank you for watching. If you have any questions, let me know. Write the questions in the comment box below. And there are certain videos in the description. Please go through them. And we'll meet next time tomorrow. Have a nice day.